Hey guys, today I'm going to be speaking to you guys about a pediatrics case for USMLE Step 2. Yes. So a 12-year-old boy is brought for slowly enlarging painless neck, noticed by his parents. So when we think about neck mass in the USMLE, we're thinking maybe two or three things. There are, of course, more. You want to know them, but one is Thyroglossal Cyst. It moves with swelling. Then we have a kind of a thing over here. It's called what do you call it? Excuse me. It's going to be called the brachial cleft. So let's go with brachial cleft. So cleft cyst. It's wrong. Okay. Okay, let's look again. A 12-year-old boy is going to be brought to the evaluation of a slowly enlarging painless neck mass by his parents. And the mass has been present. The mass has been present for several months and is not associated fever, weight loss, or recent infection. Okay, the mass has been present for several months and it's not been associated with fever, weight loss, or infection. So it's already infectious. We mentioned this. Let's start off with thyroglossal cyst then. Thyroglossal cyst, duct cyst, thyroglossal duct cyst. Yeah, we got it right. Okay, so let's read it now. Okay, a physical examination shows a soft, cystic mass measuring 3 centimeters in the anterior neck, just near the midline, just below the chin. The mass rises when the patient swallows. That's a key feature. A brachial cleft cyst will not rise, but thyroglossal duct cyst, it will definitely rise. The mass will move upwards when the patient protrudes his tongue. So when he protrudes his tongue, it can move up. Neck. And you can kind of imagine because I think the cyst is with attached to the tongue. We'll watch a video because there's a thyroglossal duct cyst duct that goes, and the fact that it's going to be attached, that it if you of course move the tongue like you're going to expect it to kind of move as well. The neck ultrasound demonstrates a well circumscribed cystic lesion with thin walls and a homogeneous contents. So that's going to be seen over here. So let's look at some photos. I think and just to understand a glossal duct cyst. Okay, let's look over here. So we're gonna be seeing over here the thyroglossal duct. It's at like kind of the bottom of the tongue, and then we have the hyoid bone, and then we have the duct thyroid gland here, duct cyst over here. So like that's going to be seen over here. So thyroglossal duct cyst over here and thyroid gland over here. So that can be seen over here. That's perfect. Then we can see, yeah, okay. So we can see it's a common congenital, usually benign midline neck lump, and it is caused by incomplete closure of the thyroglossal duct during fetal development. It typically presents as in children, a painless soft movable near the hyoid bone that moves with tongue protrusion. Treatment is usually surgical excision to prevent infection or malignancy. So it's a midline, it moves, and we can kind of, I'll just come into chat and just quickly ask them. So, so does the thyroglossal duct cyst um, move with swallowing because it is attached to the tongue? Let's have a look at this. Yes, you're thinking the right thing. The paradoxical moves is swallowing in trunk region because the foramen cecum, the region of the thyroid. Why it moves, the development of the thyroid descends from the base of the tongue down to the neck via the thyroglossal duct. The duct normally disappears, but it persists, cyst forms. The tract often remains connected directly or via fibrous tissue to the tongue base and passes through the hyoid bone. Mooses swelling elevates the larynx height, pulls the cyst up. Tongue protrusion pulls on the tract connected to the tongue base. Cyst moves. So thyroglossal duct cyst moves with swelling and tongue protrusion. Thyroglossal nodule only moves with uh, the swelling only, and thyroglossal brachial cleft cyst does not move. Okay, what is the etymology of cecum? They mentioned cecum, right? Cecum. I thought that was in the intestine. Good catch. You're not wrong. Cecus means blind. So a cecum means a blind pouch. So a structure that ends in a dead area. Why it's used in the intestine? A blind pouch is at the beginning of the large intestine. So the small intestine empties into the colon. What about cecum? It's a small pit depression at the base of the tongue, and this is the original thyroglossal duct. It's called cecum because it's blind, and not because it is related to the intestine. So it's a blind cecum is a blind hole and a blind pouch. Okay, that makes sense, guys. Thank you so much, guys, for watching, and I hope to see you guys next time.